So this test is called the active compression test. It's also known as the O'Brien test. This test is used when you suspect that your patient either has a labral tear, a slap lesion, or some sort of AC joint involvement. So what you're going to do with your patient is they're going to be standing, but in our situation, my patient is tall kneeling. And with your patient, what you're going to be doing is you're going to bring their shoulder into 90 degrees of flexion, and then you're going to maximally internally rotate their shoulder. And in this position, you're also going to bring them into about 10 degrees of horizontal adduction. So in this position, what you're going to do first is you're going to see if they can hold this position, which my patient can. And then what you're going to do is going to apply a force down and see if your patient can resist this force. So good, don't let me push your arm down. Good, and then you're going to ask your patient, did you feel any pain with that? No, and if she did have some a slap lesion or labral tear and she did have pain with that, what we would do is we would externally rotate her shoulder, still in the same position, and apply the same force down, having her resist the force. And this would be a positive O'Brien test if my patient said that the pain lessened when she turned her shoulder into external rotation. And what's also important with the O'Brien test is the location of the pain. So during this test, when my patient was internally rotated and resisting the force, if she complained that the pain was located in her AC joint area or the top of her shoulder, then you would suspect that there's some AC joint involvement. However, if the patient with her thumb internally rotated felt the pain deeper into her shoulder, then you would suspect more of a labral tear or slap lesion involvement due to that pain being a little deeper. And that is the O'Brien test.